Know about spirometry. Spirometry is a type of diagnostic test used to measure the function of the lungs. It is one of the most important and common tests used to assess breathing difficulties or diagnose lung disease. Spirometry procedure. A spirometry test is a diagnostic tool used to measure lung capacity. The procedure involves breathing into a device called a spirometer, which measures the amount of air inhaled and exhaled over time, as well as the speed at which air moves in and out of the lungs. To perform the test, an individual first has their height and weight taken so that they can be given an accurate result based on their body size. Spirometry test procedure. Spirometry is a test that measures how well the lungs work by measuring the amount of air exhaled and inhaled. It helps to diagnose a variety of respiratory problems such as asthma, chronic obstructive pulmonary disease, COPD, and other lung disorders. During the test, a patient must take a deep breath in before blowing out as much air as possible into a device called a spirometer that records the results. Benefits of spirometry test. A spirometry test is a common type of lung function test that measures the amount of air you can inhale and exhale, as well as how quickly you can do it. There are several potential benefits to getting this type of test. First and foremost, it can help detect respiratory diseases such as asthma, chronic obstructive pulmonary disease, COPD, and cystic fibrosis. In addition, understanding your breathing patterns through a spirometry test can give insight into your overall health and well-being. Risks of spirometry test. Although the risk of complications from this procedure is very low, some people may experience shortness of breath due to the strong airflow used to measure lung function. In terms of potential side effects, those who are sensitive to aerosolized medications such as albuterol can experience throat irritation and coughing after undergoing the spirometry test. Preparation of spirometry test. Before undergoing the spirometry test, it's important to be aware of what to expect. Patients should tell their doctor if they have any chest discomfort or difficulty breathing, as these can interfere with the results of the test. It's also important to inform your doctor about any medications you are taking that may affect your breathing. Patients should avoid eating and drinking before the test, as this can also affect results. Understanding the results of spirometry test. Results interpretation is one of the most important aspects of the spirometry test. The FVC measures the amount of air that can be exhaled from a full breath. This is used to detect any obstructions in the lungs. The FEV1 measures how much air can be exhaled in 1 second, helping medical professionals determine how well oxygen is moving through the lungs. Finally, FRE measures how quickly someone can exhale air. This indicates airway elasticity and helps diagnose asthma or other respiratory diseases. In addition to these measurements, medical professionals often compare an individual's baseline results with their current results during follow-up exams. Aftercare instructions. In many cases, additional tests or treatments will be recommended based on the results of a spirometry test. Your healthcare provider can help you understand what happens next based on your individual results. Conclusion. Final thoughts about spirometry. The spirometry test is an important tool for measuring lung health. It is used to diagnose and monitor the progression of a number of respiratory disorders, including asthma, COPD, and interstitial lung disease. This information will allow doctors to better manage these conditions and ensure the patient receives appropriate treatment.